Automated Podcast.
Welcome to Automated. I'm your host, Mark Verbenkov, and in this weekly podcast, we will be exploring the impact of emerging technology on jobs, society, as well as us, with business and technology leaders, researchers, and independent professionals across the world. So I think one of the really interesting things when we're talking about artificial intelligence that has become actually quite apparent in a number of other podcast episodes is its diversity of application. So for those of us following this very impressive technology, it really does seem that there is no place where AI cannot be used. Nonetheless, I was both surprised and intrigued when I came across X2 AI and their Tess chatbot, which essentially allows people to have conversations with an AI that is specifically designed for mental health support. So if you're curious at all about how this is possible, what kind of benefits that an AI therapist can bring to people, and of course the ultimate question of whether we will have human therapists in the future or not, then I think this episode is absolutely for you. So my guest to talk about the AI chatbot Tess is Michiel Rauws. He is the founder and CEO of X2 AI. So as a former patient and longtime peer support counselor, Michiel was compelled to start X2 AI, which has so far provided access to 29 million people and has de-escalated over 8,000 suicides. So Michiel also leads the X2 Foundation, a non-profit aiding underserved communities by providing free access to X2's chatbot technology. Michiel and his team at X2 believe that mental health care should be equitable and available to everyone, regardless of geographic location or income level. And we will be discussing the foundation a little bit later in the podcast, but if you are a nonprofit and you're interested in partnering with them, you can find more information at x2ai.com/impact. And I'll have all the links, of course, as usual, up in the show notes.
Oh, that was fun. On the previous podcast, I forgot to hit record.
Yeah. I always make sure that I hit that record, and I always make sure that that lady tells me that I'm recording. Otherwise, I don't want to waste your time doing this a second time.
Yeah.
Awesome.
Good.
Great. Well, Michiel, thank you very much for coming on to the Automated Podcast. It's great to have you here today. I'm really looking forward to discussing the specific technology that we're looking into. I came across it about a year ago, so I'm very curious about asking you about all the questions that we've discussed before. So thanks again for coming on to the podcast. It's great.
Yeah, certainly. My pleasure. Always interesting to talk about the developments in this field. And often it's hard to keep track of how much is changing by day to day.
Awesome. Love to hear it. So as I mentioned right before, if we could just get a little bit of your kind of personal interest as to how you got into this interesting technology, into the work that you do. It's always the way that I like to start the podcast, to give a little bit more of a personal touch to the guests' introduction to the audience.
Certainly. Yeah. So it's very personal for me. So now we're going to go into my personal life story almost, because it started out with a problem. As many of these developments or startups start out, like you start with a problem. And my problem was that I myself was in therapy in my teenage years. And to me, I lived in the Netherlands back then, and access to care was for free. It was almost instant. There were no wait lists, nothing. I had a tremendous good experience. I felt so much better afterwards. And I kind of started preaching the same things that my therapist had told me to my friends and family. And then every time I heard them having issues, I would try to help them. And then later in the workplace, same thing. So I basically became like a peer support counselor. And what I started realizing was that so many people have things that they need help with, but they wouldn't really want to go to a therapist because it's so much work. Because over the years, there's almost wait lists everywhere. And then especially here in the United States, where I moved to, like there's very high costs, there's co-pays you need to pay. And so there's just, it's so hard to find someone even who has time for you. So there's like a huge problem getting access. And I was realizing that my peer support work was really helpful to a lot of people. But at the same time, I always try to nudge them towards like, okay, now you need to go and either practice these things on your own, or it's time for you to talk to a therapist. And I realized that there's so many more people who need that support. but just don't get it. And that's when I felt myself like, okay, like I'm doing sort of a bad job because I should be helping more people. How can I do that? And
Right.
at the time, there were the first kind of things coming out with AI. There was Watson, and some of the language models were slowly getting better. And so that's when we thought like, well, maybe we can simulate part of these conversations,
Mm.
because what I had seen in a lot of these conversations is there's a lot of patterns in how I was helping people. And so I tried like, okay, let's try to make a system that can partially simulate these conversations, and maybe it's got to be helpful.
Very interesting. Yeah, when I was looking at your website, and of course some of the other applications that are out there, one of the things that I guess I first wanted to ask, like, what exactly is this, right? So we're talking, of course, about AI chatbots for therapy, but maybe we can just immediately dive into like your chatbot is called Tess, and I think that for the audience it would be a really good place to start to just talk about the technology itself, because I think there's so many different paths and avenues that we can go down, that I think that this is a kind of a solid place to start for the audience to kind of understand what exactly it is that we're talking about. So if you could just describe a little bit about what Tess is, I think it'll lead into the rest of the conversation.
Yeah, so we tried to keep it as simple as possible.
Mm-hmm.
So we just made a phone number that people can send a text message to. And in that way, the first text message might be something like, hi. And then the reply that comes back from the mental health chatbot from Tess is, hi there, nice to meet you. My name is Tess. I'm a mental health chatbot designed by psychologists, and I'm here to help you. Are you ready to get started? Question mark. And then the person says yes, and then like that, the conversation kind of unfolds. We also present privacy policy, because it's very important that people know exactly what happens with their data and that their data is safe and secure. And then we slowly get into like, okay, so do you currently have something you're very stressed out about, or feeling bad about? Then we can go that path and start talking about that. Or are you just coming here more from a perspective of, I have some things I might want to talk about at some point, but let's see where we can start.
Like an
And in that way,
exploration. Yeah.
yeah, exactly. And that way we kind of go down different routes. And yeah, we try to be as helpful as possible. And if the topic is like, well, I'm super stressed out, I'm at my job right now, and people are getting fired, I don't know what to do, then we would say, okay, thank you for sharing this with me. And we might do some reflection of like, just like a coach would do, like, oh, well, I'm hearing that things are really stressful on your end because of these things happening. Maybe it would be a good idea to start off to get rid of some of that acute stress. Maybe we start off with a breathing exercise. And if that helped, then great. If it didn't help, then we try something else.
And at any point, is there a human on the other end, or is this entire conversation done with this AI chatbot?
The entire conversation is done by the chatbot. At any point when it's needed, there is a human involved.
Okay.
So if there's anything about crisis, if we see any warning signs, any red flags, any early signs, then we will make sure that a crisis counselor gets involved. And yeah, as a really practical example, if you would say, I want to hurt myself, then literally an alert goes out to the crisis center, and in under 1 minute, a crisis counselor calls or takes over the conversation, depending on the arrangements with the customer or with that particular project.
Right. And I mean, we've talked about artificial intelligence in the different kind of applications in other episodes on the podcast, but could you maybe discuss a little bit as to how the AI was trained? Because I think that's always quite interesting for people to hear about.
Yeah. And when I started the company, I thought it was going to be easy. There was going to be data sets everywhere.
Right.
And originally, I come from a research university, so it's like, oh, I'll just walk to that university research department, talk to the psychologists, and be like, hey, where's the data? But obviously, that data is not there. And even especially at the time, like the deep learning algorithms, like wouldn't even have been good enough to really use that in a very helpful way.
Mm-hmm.
And yeah, and that way we just really had to start from the ground up to say like, okay, let's make a very simple system first that can just like really do psychoeducation, as we call it. So like a breathing exercise is a simple explanation of how to do a breathing exercise. Really like it's a summary of a book, sort of. So in that way, we just started very simple. And then the beauty is like the more people are chatting, the more people are talking, the more times psychologists or counselors are taking over conversations, etc. Um, the algorithm learns, and we make sure that it improves. And at the same time, a big part of this is keeping AI on a leash,
Okay.
as I coined the term, where it's very important, like in a customer support setting, where you're talking about a user manual or how to change your order. There, it might be fine to do a lot of automated learning and like kind of let things automatically improve.
Yeah.
For us, it's really important to sort of version management. So each time there's a new version, we really make sure that we really double check that nothing strange got into the code or nothing strange got into the model, so that we don't get something where what has happened with like the early chatbots, like the one from Microsoft that they did in Asia,
Mm-hmm.
where large groups of people were chatting with that chatbot, and then they managed to manipulate it in a way to then start saying negative things. Let's
Yeah,
put it that way.
I remember the example. Yeah, yeah. 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 Okay. Very interesting. Yeah. The one of the reasons that I ask is it's also a little bit connected to what you were saying before about how it's leashed, right? So I've asked a couple people that have actually gone, like some friends and some acquaintances that have gone through therapy or are currently in counseling, about their initial thoughts about even conversing for the first time with an AI mental health chatbot, and I got some mixed responses. So I'm certain that you have also experienced this with people that are uptaking it and starting to use it. There might be, I mean, maybe not necessarily a negative connotation about artificial intelligence, but people are maybe a little bit wary of AI. So I'm really happy to hear that there's kind of a, AI on a leash, because I think a lot of people might be a little bit like, oh, I'm unsure if talking to a computer, if you will, would actually bring about those kind of positive benefits that I will get into later. Have you encountered this kind of reluctance from a number of users? And if you have, like, how do you deal with that? Because I think that's quite interesting for anybody that might be listening to, thinking about, getting involved with chatting with an AI.
Yeah, no, it's a very real concern, and that's what we saw back in the 60s
Mm-hmm.
with Eliza at MIT, where they had a psychotherapist
Right,
bot.
right.
And so that went even deeper down into like people's personal past and even more personal. And yeah, that hit the headlines because it was so controversial and was so like scary.
Mm-hmm.
And that's why we try to make it as clear upfront as possible to say like, well, I am a chatbot,
Mm-hmm.
um, and here is my privacy policy, so you know exactly what happens to your data. And in general, the work we have done is we have made sure that really from a healthcare perspective, basically the summary is the conversations with the chatbot are as secure as your doctor's notes.
Mm-hmm. Yeah, I think that's especially with all the kind of like news about Facebook over the last couple of years, the privacy issue has grown more and more, I guess, stressed. So I'm really happy to hear that that privacy is, of course, very important to your company as well as to the chatbot, especially as people kind of have maybe this hesitancy to talk to computers, or unsure experience with talking to computers in that sense. Okay, so Michael, maybe we could touch on a little bit more about the specific aspects of Tess, or the user base of Tess. So I was looking up on the website that you have, numerous users, and maybe for some of the audience that might think that it's not actually used by that many people, you could touch on the actual number of users that that Tess is being used by.
Yeah, of course. Yeah, we've been at this for a while. So at the beginning, it started small because if you start small, then you can really contain the quality and make sure everything is safe. And that was the most important thing to get across at the start. So in the beginning, the numbers we looked at per project or per customer were maybe in the hundreds, and then later was in the tens of thousands. And then now the exciting thing is like with the customers we're talking about like, oh, for your engagement or your project, we're already seeing hundreds of thousands people chatting or hundreds of thousands of people chatting. So it's been a very exciting evolution. And also with regards to messages, which is kind of another amplifier, because you might think like, well, you might have that many people chatting, but if they're all exchanging 10 messages, then that's still nothing.
Yeah.
The exciting thing is that also we're talking about millions of messages. And yeah, it's also just so exciting. We have these real-time dashboards for our customers where they can really see real time how many people are chatting. And one example of that is this project with Deepak Chopra Foundation, where their publication in the newspaper said 89,000 people helped. And I was just recently checking their dashboard, and they're now already at double that amount of help provided.
So this is really scaling up rather quickly. Do you also see within, say, 5 years or so that the number of people will double, triple, quadruple per year, or are we going to stay mostly within the United States, that there's going to be, several hundreds of thousands of people being active every year?
Yeah, no, and that's super exciting. Like also with regards to languages, when we
Mm,
started, we were actually supporting Arabic and English to begin with, because we were helping Syrian refugees.
okay.
And then later was like, okay, that's like very difficult to keep multiple languages maintained. But nowadays with like translation services becoming so much better, it's actually easier to do. So nowadays we're offering it in English, Spanish, Dutch, and Arabic.
Okay.
And yeah, really, what we often hear now with our customers and new customers that we talk to is they say you're kind of the best kept secret that nobody knows about. And that's really the stage that we're at. That we've done all of the hard work and labor to do all the research to show that it's safe, to slowly scale things up, to scale it up more and more. And that now really we're getting close to the point where we can say like, hey, we can like really grow super fast, but we want to do it in a diligent way. So yeah, I'm excited for the future, so to say.
Perfect. Yeah,
Yeah.
that's super interesting. And maybe I should have asked this more at the beginning, but like, what kind of depth does Tess go down? So you were talking about like psychoanalysis is a little bit off the table here, but is it? Yeah, I'm just curious as to like what kind of depth, the kind of support that the AI chatbot gives.
Yeah, so we actually want to make sure that like what happens if there's a very good coach or a very good psychologist. They
Mm-hmm.
basically have used whatever they've learned throughout their career and during their education, but also continued education. They kind of use that mixed bag of different approaches to try and
Mm-hmm.
figure out like what's really going to help this person. So really, we follow that same principle. And if people want to have very practical advice, like really like psychoeducation type, or like sort of directive of like, I'm very stressed, what do I do? Well, you do breathing exercise.
Mm-hmm.
Let's see if that helps. Usually helps 90% of people, so why wouldn't it help you? So that's like very directive, very simple. But then there's also conversations we make way more open-ended. And then it almost just becomes like you get out of it what you put in.
Mm-hmm.
So if you yourself are chatting with it and you're really giving very serious answers, you're really truthfully answering why you think certain things have happened in your life, like you think about the question, like there might be a question saying like, okay, um, um, with regards to different types of personalities, like, okay, your personality is that you get stressed kind of fast. Okay, can you think of anything like maybe within your childhood or like in your past that might have kind
Mm-hmm.
of enforced this pattern of getting stressed quickly? And then if you really think about that, you might say like, oh wow, yeah, I guess like my parents, like they got stressed pretty fast all the time. I guess that they had a big influence on me. Okay, let me give that as an answer. And if you give that as an answer, then we have something to work with, and then we can go deeper further. But if someone just says like no idea, then we'll stay at the surface.
Yeah. Yep. So in a sense, it is kind of like talking with a human, right? You're able to go down deeper as depending on the kind of answers that you give to the chatbot, which is quite interesting. It's not just query some, as you were saying before, some articles, breathe properly, and just don't stress. It definitely does go a little bit deeper. Very interesting. So one of the things that I was definitely interested in asking you was about the kind of success cases, right? The benefit that's actually brought to the people that are using this. Again, the friends that I asked were maybe a little bit hesitant or unsure that there would be actual benefit experienced by, you said a couple 100,000 users, by anybody if you're actually talking to an AI. But I think that this is more to do with the kind of how people are unsure about actual AI proficiency, right? Like, we all understand that AI is quite powerful, but I still think many people are unsure as to just how powerful it is. So if you could touch on, the benefits that are experienced by some of the people that are actually using Tess.
Yeah, and I'm almost on the spot kind of think of an analogy where if you get a gym membership, you are paying money to go to the gym, but you're probably not going to get much out of it if you just stay at home on the couch.
Right.
If you show up and you go to the gym every single day or every other day, and you have a regiment and an exact schedule, etc., and you're following the right procedures, yes, then you're going to get a lot out of it. And the difference I have seen is people have different options. So some people who are very well off, like, they don't even have to be on the wait list. They can just pay enough money out of pocket, like $300, and get an appointment with a therapist next week. And if you have that ability, and if that money doesn't mean much to you, and if it's easy to do that, then that is the right thing for you to do. And that is what I recommend such a person to do. Like, hey, like, yes, do it. That's the highest quality type of care you can get. But sadly enough, the majority of society is not that well off and does not have that option. A lot of people are stuck on wait lists. And in a way, those are even the fortunate, because they have health insurance that pays for it. And they have the ability to go to the therapist in the first place to make that space in their schedule. And then what we see a lot is there's just such a huge part of the population who might not even have the insurance, or they can have some of the benefits maybe through their insurance, but the copay is still very high. That's money that could have gone to food. Or they just cannot take the time off of work. They're working 2 jobs, 3 jobs, and they just don't have the time to travel somewhere, or even to get on a Zoom call. Like, even that is like, well, it's an entire hour. Like, it needs to be during business hours. Like, yeah, that's not really gonna work.
And I think this ties into a little bit of the X2 Foundation that you set up and you're involved with as well, right? So we're talking about people maybe in the West that don't have necessarily that much time to initiate with an AI mental health chatbot. But I think some of the work that you've done that I was able to see, I mean, this is places all over the world where people wouldn't have any kind of access to this if it wasn't for the kind of support that you guys are doing. Could you maybe touch on that a little bit? Because I think it's quite interesting, but maybe also quite relevant to, having the world a little bit more at a higher level when it comes to mental health, which I think is quite interesting.
Yeah. So that's like, we operate mainly within the confines of the United States, and like trying to like help out there wherever we can. We actually have quite a few like worldwide projects going on that like still, even though we have that focus. But one of those is with the Deepak Chopra Foundation. And the really exciting thing there was that he said, like, I just want to help as many people as possible all over the world. How can we do that? And so there, what we said was like, okay, well, it started during National Suicide Week, actually, or Worldwide Suicide Week. And he works with someone called Gabriella Wright. She's an actress, and she unfortunately lost her sister to suicide. And her sister's nickname was Pee-wee.
Okay.
And in that way, they dedicated their custom version of our chatbot to Pee-wee.
Hmm.
And in that way, they created that custom version. Um, and then they had this whole campaign. It was called neveralone.love. That's the web address. And that's where people can actually sign up and try out Pee-wee. Um, and they recently published an article in the San Francisco Chronicle, or SF Gate, I believe. And back then, the results were that 89,000 people had received support, and
Okay.
that 3,500 people who were experiencing suicidal thoughts were able to de-escalate
Hmm.
their conversations.
That's pretty powerful when somebody might be thinking that AI, in any case, in any scenario, in any application, might not actually bring about a real world change, but that's some clear evidence that it actually does. And this was this were they in specific countries, or was it kind of all over pieced together in the places that the bot was used?
Yeah, that was an exciting thing to see that it was really worldwide,
Okay.
like really
Yeah.
like every country, and like even things that people might not expect at first. But we even saw like in rural Africa, a lot of
Hmm.
people sign up, and for them, like the main way they sign up was through Facebook Messenger,
Okay.
and for them, like they have internet on their phone, and sending messages back and forth is not going to cost a lot of data,
Hmm.
but it is suddenly like um, content that has been written by psychologists in the United States, um, which like yeah, that's like very high, the highest quality you
Yep.
can get.
Yep. Yep.
Um, and then suddenly, like in rural Africa, you get access to that. Like that's phenomenal. That's amazing.
It's amazing. Yeah, really, really. It's almost like you're decentralizing a lot of the kind of the top tier information to the rest of the world, which I guess is one of the things that the internet has been known for, but now it's coming in a more very personalized manner through these AI chatbots. That's very exciting. Were there any other kind of benefits that you've experienced either in the West or throughout the world? I mean, the de-escalation of suicide, I think, is probably one of the most powerful things. But have you seen people like have reduced anxiety or some of the other kind of mental health benefits from using just the AI chatbot?
Yeah, and I think because it's such an important topic, it's worth kind of diving deeper
Mm-hmm,
into
mm-hmm.
like the suicide handling,
Sure.
um, because in the end, it's evidently clear that the best person to handle with someone who's in crisis or in a suicidal crisis is a person, like a
Mm-hmm.
trained professional, like a crisis counselor. Um, and that's why we acknowledge that and we say like, okay, um, as soon as we like detect that there's something wrong, we will loop in that counselor,
Right.
and that counselor will read the conversation and say like, hey, I'm going to take over now, etc. Um, what is really important to realize is that um, the thing that Tess does, or Pee-wee in this case, is being there when the person might not have reached out to the crisis counselor. Because in
Right.
many countries, there is a crisis line, a national crisis line available. Like people can call like 911 in the US, but there's also like a national suicide line.
Mm-hmm,
And
mm-hmm.
it's staffed with free counselors who will help you de-escalate the suicide situation. Um, so it is definitely available. But there's always kind of this hurdle of reaching out. Like when you are in that state, when you are feeling very down, when you are having a very hard time, it's very difficult to go and say, yes, I'll
Yeah.
reach out to this phone number. But if you are in that state and suddenly you get a text message, and the text message is saying something like, hey there, how's it going? Um,
Yeah.
I know everyone has ups and downs. Um, I'm here for you. Then suddenly it's like, oh, that's much easier to reply to. And like, oh, that message, like just reading that someone or something is there to talk with me, like that's already nice. And then in that way, it's really like, in summary, it's like Tess is there whenever any other service would not be there. so that at least we catch it, at least we detect it, and then we can hand it over to the professionals.
Yeah, it really sounds like it's reducing the barriers of entry to start your kind of mental health healing process. And then, of course, the potential for scaling this up is phenomenal compared to, you know, having a one-on-one discussion with somebody. Very interesting. So, I mean, we're still in this pandemic that seems to be going on forever. I'm assuming that you also saw an increase in usage throughout the pandemic. Could you, I don't know if you have specific numbers on that, or if there was a change in the type of questions and conversations that were happening. Could you touch on that? Because I think that's quite interesting.
Yeah. So definitely, like, so we have like different ways we implement our systems. So sometimes we might work with an employee assistance program, and they cover a couple of hundred employers, and all of those employees have access. And in that case, there's different aggregate level reporting that we are allowed to do and that we convey in our privacy policy. Where, for example, for that assistance program, we would let them know, like, hey, these are the most common emotions that we're seeing. You might want to implement more resources helping people that way. Or you might want to send out more newsletters specifically focused on social isolation, because we're seeing this as a problem. Right. So really, in that way, we're trying to adjust to what's currently happening, and also letting our partners know how to help them. Also, when we work with an HR department, for example, we can make sure that they send out the right resources or set up a webinar. But we've definitely seen like a huge increase in people needing help, and also the severity to which they need help. So this ties into a lot of like how we look at outcomes. So we started out as a research firm, and then only because our research project was such a success with one of the bigger research partners, they said like, hey, we want to roll this out for all of our 240,000 patients. What's it going to cost? We're like, well, we have to set up a company first. So that was really like the very early beginnings, very like kind of relatively small implementation compared to what we do today. But that was really the point that we saw, like, hey, there's really a need for this. But also we always continued to do the research. Yeah. So you can look on our website, x2ai.com/outcomes, and we actually have posted all of the research that's published. And I think there's already 3 more papers that have been published, because we make sure we always work with the research community. So initially we did a lot of the research in-house and helping the researchers. And now often we actually have a lot of partners who say like, hey, like, let's put in our privacy policy that this can be used for research purposes, so that people are aware of it. And then they just end up with these data sets of like a couple of million messages. Right. And they're like, hey, like, can we check the effectiveness of our system so that we can let our people know that this is really effective? And that's when we work with either their like internal departments, research departments, or external research partners. And yeah, in that way, it's also like nowadays, if there are researchers who are interested, like, we actually have a lot of openings, so to say, of like data sets that are looking for a researcher to publish the result.
Okay, interesting.
So yeah, we try to be very open like that, like as like, yeah, like, I think the more research that comes out about this, the more people have faith in it being safe and it being helpful, and really like looking at the decrease in symptoms. And in that way, I think for the industry as a whole, more people will just embrace it and get more help.
Yeah, I was actually looking at that before the conversation, and I know that you have a couple like stats up there that I mean, for me, it sounded like, wow, this is actually very beneficial for people that are using it. Could you maybe touch on some of the maybe more interesting aspects to make it a little bit more tangible for anybody listening?
Yeah. So one big problem that we're seeing today in healthcare is that people who are supposed to have access because they have the healthcare insurance and are paying their premiums do not get access because they're stuck on a waiting list. And that's really like a piece where we believe it's very valuable that we can help people. And in that way, we actually see that what we do is we start the conversations with a screening, like a depression screening or an anxiety
Okay.
screening. We use the same one that will be used in the intake process. Um, and that way we have a baseline, just like your doctor at your like local branch would. And then a couple of weeks later or months later, depending on the severity of their symptoms, we check in again and we do the exact same survey again, which is the same way a lot of health systems do this, to look at like, was this a successful treatment? Should we provide more sessions, or has this person decreased their symptoms enough that it's now fine to let them go off on their own and they can keep practicing what they learned and they'll get back fully on their feet.
Mm-hmm.
So that's the methodology we use in our research to look at effectiveness. And yeah, in that way, the really exciting thing is that we just see that so many people who are on the wait list, they actually have enough symptom remission by 50%, which is usually kind of the gold standard that's used in therapy to say, or in coaching, like, hey, if you're 50%, have a 50% reduction in your symptoms, then you're good to go again, and you can be on your own again. So in that way, like, it's really exciting to see it where a lot of people who are on the wait list can actually help themselves through self-help. And then what we do is we make this self-help just more engaging because it's a chat experience.
Yeah.
And that way they manage to help themselves reduce their symptoms, feel better again, and then they don't even have to see someone anymore, and don't have to be on the wait list anymore. Then they open up a spot on the wait list for someone who has issues that cannot be helped with self-help and really needs to talk to a therapist sooner.
Right, right. So I think you just touched on something that's super interesting and also probably the most relevant aspect for this podcast, for the theme of the podcast, which is kind of the automation of work, right? Which we talked about a little bit before the recording. I think we've touched on it a little bit, or at least you mentioned, some of the potential aspects. But if I'm putting myself in the shoes of a listener, I'm hearing, okay, this Tess AI chatbot is able to reduce 50%, or I'm assuming more in certain cases, the kind of mental anxiety or issues that somebody is having simply through a conversation over text or over Messenger. What is there left for the psychologist, for the therapist, for the counselor to do now? And then we can touch on it in the next couple of years, 10 years or something like that after. So yeah, maybe just to touch on like the automation of work as it applies to your industry.
Yeah. So the way currently the healthcare system is organized is that there's different levels of severity of someone's symptoms.
Mm-hmm.
And in that way, there's different levels of people who will help. So if someone has a very severe disorder, if they have maybe like severe schizophrenia, then they will most likely talk to a psychiatrist. And if someone has mild anxiety, then it might be sufficient to talk to a coach or a social worker.
Mm-hmm.
And so in that way, there's different levels of issues that are paired with different professionals who can help those people. So in that way, the way we really look at it is that as we've always done that we have these different levels of severity, different levels of capability of handling people's emotions and handling people's symptoms and reducing them. In that same way, Tess is simply another addition to that same hierarchy. And Tess is simply there to be able to help a certain group of people very well. And that allows then the other professionals that are helping other types of people to have more time to help those people.
Right. Okay, yeah, perfect. So it's kind of like unburdening many of the professionals that need to deal with the more severe cases. Super clear. I have a couple friends that are actually counselors, so I'm sure that they're happy to hear that. But as I like to do in the podcast, maybe we can look a couple of years ahead from us, right? So as the capabilities and the comprehension of Tess and other AI chatbots that focus on mental health improves, right, through the active training that's being done, do you see that this kind of lower level, if you will, of capabilities will increase as time goes on. I don't know if there'll ever be a point where you can touch on like the highest level of mental health professionals, but do you see that maybe, you know, it might go up one or two rungs on this ladder of professional support?
Yeah, those are very important conversations to have. And we have a group of people that actually helps us think through these things.
Okay.
So when we have certain issues like this, that we're like, is this an issue, or like, do we need to handle this differently? Or then yeah, we have like a group of people, like it's our like kind of medical ethical board, that kind of can help us with these existential questions
Right,
almost.
right.
And it's very interesting because to a degree, um, self-help has been around forever. And what we're doing is making sure that self-help is more interesting, more motivating, easier, it's more engaging. And in that way, um, yeah, it just gets better. And to a big degree, what I noticed myself as a patient, when I was in therapy, um, I always had these epiphanies. And I was
Yeah,
like,
yeah.
oh, like, oh, now I get this, or like, oh, now I get that, or like, oh, that might have been because of this. And that was a certain style that my therapist had, where and like different therapists that helped me often like had, where they were kind of guiding me and like making me have these insights. So in that way, there's really a partnership where there's the patient that needs to do some thinking and some deep work, and then there's the counselor who's helping you and guiding you. And yeah, I think that's the exciting thing looking into the future is, to a big degree, there is the participation of the patient, helping themselves feel better. And yeah, what we're gonna see is where kind of the limits going to be. And I always like to look at how things are currently done. So currently, what happens is, um, if you become a counselor, you get your PhD or your master's degree, you get your license, and then education kind of like is on pause for a little bit, and you're really getting more experience by just talking to more people and like seeing what works, but you're still getting guidance from someone. You're still getting guidance from a counselor. Like still you're doing revision sessions, reflection sessions with other counselors, other therapists to make sure you're doing the right thing. And then there's conferences where psychologists come together and share like, hey, this is a new approach. It seems to be working really well. Like more people should try this out. Um, and so like that, there's always kind of learning going on. And the world is also always changing. So there could very likely be totally new kind of modalities coming out, psychological
Right.
modalities, different ways of helping people about anxiety related to medical issues such as COVID. Just because it's like, I don't think we've ever had at such big scale, at least during my lifetime and my parents' lifetime, a pandemic that was so severely impacting people's freedom, that's something we're used to. So that there might even be like a whole new school of thought of like how people could be helped with that. And I think the exciting thing is now that that's mainly done by therapists. And what could happen is that the chatbots can become a tool to get them more data. So if they say like, oh, I think I have figured out this one approach that works really well, and I wish that more people knew about it. Yeah, if you take that, if you contact us, and literally this has happened in the past, if you contact us and you say like, hey, I have this phenomenal way of helping people. It's been, I've proven it myself. My colleagues have proven it. Maybe there's been some papers written about it. Can we add this to your platform? And then we of course vet the content. We make sure it's like very very legit and high quality, and then we can start trying it out. And then the exciting thing is suddenly you can try it out with like in all of these like millions of messages going in and out.
Right,
And you
right.
suddenly get so much feedback on how well it works or doesn't work. So I think that's going to be kind of the next stage where it's really an amplifier for the experts, to instead of doing one-on-one sessions or group sessions, they can just put their expertise in what they learned during their one-on-one sessions into the more overall system, and in that way really help people at massive scale.
That's super interesting. I see that the time is winding down, but I do want to follow up on that a little bit more. So, if I understand correctly, it really sounds like Tess could be the platform to implement a lot of these new kind of modalities or practices or methodologies that a lot of these mental health professionals are using. Do you also see that it could be the other way around, that through the massive amount of messages that are happening on the Tess platform, that mental health professionals could pick up maybe new ways of interacting, and then through understanding that they could implement it into their own practice? Or do you only see it as kind of a one-way way of learning?
Yeah, no, that I think is going to be very exciting.
Yeah.
And that's going to be yeah, like from like our research background and always doing more and more research, working with the research community, like those are things we very much embrace, and like we'll yeah, like talk with the right experts, talk with the right clinicians, and like yeah, slowly try and like see if that's appropriate. And yeah, I think it's really exciting how that can be like kind of a two-way street.
Mm-hmm.
um, and I think the kind of classical example here is where, and I think it's, yeah, it might not be the strongest analogy, but there's been talk about within radiology, where they use the AI system to analyze these scans of the lungs
Mm-hmm.
to look for tumors, and that um, it's very much, it was clear that they kind of hyped it too early, I think, and then they kind of had to recall a lot of it because like they kind of like tried to overuse it. But I think as an assistive tool, is very helpful, where it was actually able to find tumors that a radiologist wasn't able to find and to spot.
Right.
And just because it used kind of a different, new, fresh methodology of spotting them, and then that can actually teach then the radiologist like, oh, maybe also look for that type of structure, because you'll might be able to find more of it.
Yeah, that's super interesting. If that can be then applied to these mental health chatbots and tests in particular, I think is a very interesting future where we'll be learning from AI to a certain extent, rather than as you mentioned, a lot of these counselors and therapists and psychologists feeding information and new modalities of practicing with people into the AI. That two-way street, I think, would be very interesting to see in the future.
Yeah, and I think as well, like exciting things to think about is,
Mm.
as an industry as a whole, like a lot of our focus has been on symptom remission.
Mm-hmm.
And that it even gets as clear as like, okay, how can we get 50% of the symptoms down? And at that point, treatment is done. Like
Mm-hmm.
that's in a nutshell, like how a lot of these processes work. And the exciting thing I think that might happen is, as more and more of kind of the pressure on the system gets relieved and
Mm-hmm.
this wait list becomes shorter, um, there might be more and more of an opportunity to be less strict about it, and to say like, well, why would we aim for 50% reduction? Why don't we aim for
Mm.
that as the first stage? And as the second stage, like, let's make sure you become the best version of yourself. Let's see like, okay, you're now feeling good. You're now not held back anymore by anxiety or by depression or by anything else. Um, what is the next thing you want to work on in life? What are your goals in life? Like,
Mm.
what were your dreams when you were a kid? Um, let's see if we can do some coaching to like, if your dream was to become a pilot, and you're in a later stage in your career, okay, maybe it's too late to become a commercial pilot. However, perhaps it's possible to become still a pilot of like smaller aircraft.
Yeah.
So in that way, just really like moving from like the focus on the symptoms to becoming the best version of yourself.
That's fascinating. And AI would be able to help many millions of people, right? Do this at scale. But
Yeah.
yeah, rather than just reducing the negatives, you could increase kind of the overall positive of the human race. I think that's a fascinating idea. So you would definitely be in the camp of AI is going to be benefiting the world compared to the other camp where AI is going to be a kind of a net harm.
As long as it's kept on a leash.
Yeah. Okay.
and
Okay.
and
Perfect.
and we handle things in the right way. So we also publish an ethical paper on kind of our standards on how we kind of approach this whole trajectory. And yeah, it is going to be, the hope is that it's more and more predictable how it's going to develop,
Hmm. Hmm.
but you don't know, because it's either relatively close or very far off, but it's just very hard to predict these things.
Yeah.
And so I think the most important thing is just to stay very diligent and to really have times for reflection and like make sure everything's within ethical frameworks and make sure that the impact is right. And then there's even a whole new podcast we can record about what is right and what's the right way of going about things. I would suggest as a starting point, you can start reading our ethical paper.
Perfect.
But that's our beliefs on what's the right way of going about this.
Well, maybe that's a perfect place to end this very interesting discussion. I think it gives kind of a solid bite into the world of AI supported mental health. So thank you very much for that. And I'll definitely have to have you back on the podcast, and maybe we can dive deeper into the ethical concerns that this raises. So thank you very much. I will, of course, have your website, and I think you mentioned the impacts and the outcomes links, so I'll definitely have those in the show notes. Is there a preferred way for people to contact you or reach out to you? I'm assuming LinkedIn or some other way?
Yeah. So LinkedIn is very good. And then the other way would be, actually, surprisingly enough, info@x2ai.com.
Okay.
I believe that's the same way where we got connected. And that actually makes sure that multiple people look at that inbox, and that way it's really made sure that you will get a reply. And that's probably the best way, next to LinkedIn, or maybe Twitter is another place.
Okay.
Yeah.
Terrific. Well, I'll have all those links up in the show notes. I can't thank you enough. I think it was very interesting, and also for me, kind of one of the first times that I bit into the realm of AI and how it's going to be impacting mental health for the good now and in the future. So thank you very much for your time. Is there any kind of final message that you want to leave with the audience before we end?
Well, I want to thank you for this opportunity. I'm always happy to talk more about what I've learned over the years. It's been many years of very hard work, and hoping to help many more people. And also through our foundation, we try to give as many people access as possible. So if there are people who are researchers who are interested in working with us, looking at some of that data, make publications out of it, very much appreciated. And if there's people who say hey, I have this wonderful nonprofit, we want to give more people access, then they should definitely email us, because our nonprofit will be able to give their nonprofit access in that way.
Perfect. Well, that's a great way to end. Michael, thank you very much for coming on to the Automated Podcast, and I'll have to be in touch with you to get you back on at some point in the future.
Sounds like a plan.
Great. Thanks. Well, that's it for this week's episode. Thanks for listening. If you like what you hear and you want to support the podcast and the conversations here, the best way to do this is to go onto Apple Podcasts and leave a review, as it helps the algorithm to reach out to new listeners and brings the show to them. Also, feel free to check out the website, automatedpodcast.org, where you can find the show notes for each episode, written articles on the themes of the podcast, and a library of resources on the topic of emerging tech and automation. Also, if you want to reach out and leave any feedback, or you have any questions about the podcast or any of the conversations, there are general contact links such as email, LinkedIn, Twitter, etc. for you there on the website. And finally, for those of you that want more than just an audio conversation, the video recordings are now going to be up on YouTube for the newer conversations, so feel free to check out the videos by searching for Automated Podcast on YouTube, where of course you can like and subscribe if you prefer to support the podcast that way.
The Automated Podcast.